sort of a dual role. And I'm excited to be here talking with y'all. I'm excited to hear what questions you have too about graduate school.
Brad, he, him pronouns. I am currently an associate professor and a licensed psychologist in the counseling Ph.D. program at Colorado State University and the director of addiction counseling, which has a 2-year terminal master's degree in addiction counseling at Colorado State University. And in both programs, I sit on admissions committee, and in the addiction counseling program, I actually chair the admissions committee for that program. And I also talk really fast, so if I say things really fast today and you repeat them, I recommend just throwing things at me. I'll slow down.
Okay, I can speak a little bit to my experience, like leading up to being in this program. I got my undergraduate at CSU, Bachelor's of Science in Psychology. And I knew that I wanted to go to grad school, which not everybody does. I know that people say that you can't really do anything with a degree in psych, and I don't think that that's true. My sister got her degree in psych and she does background investigations now. So there's definitely options outside of that. If you are considering grad school, one of the things that I would recommend is starting your search early. Also looking at the program's curriculum and seeing, do I actually want to be sitting in these classes? Because if it's not something that you're passionate about, it's going to be a lot more difficult to make it through an entire program. So consider where your values are, where your interests are, and if those actually align with the program that you're looking to go into. Another thing I would say is letters of rec. Just make sure if you're asking people for them, you're asking early, because these people are taking time out of their lives and they're trying to support you and your goals. So be considerate and don't ask them 2 weeks before the deadline, because 1, you probably won't get a great letter of rec that way. And 2, it's just nice to be considerate because they are going the extra mile for you. And then a final thing I would say, if you're considering like a counseling program in general, UNC is great. We have an internal prac for our first prac experience. So that's basically like you're getting feedback from lots of different people and getting support from lots of different people. And that's something that I've realized in my time is rare, is having that initial experience of having your doctorate supervisor and then having a professor also watching your sessions with a client, because you're kind of going into the world after that and helping out people. So it's really cool to have that support prior to being set free into the world to do counseling with people. So those are the little takeaways that I have from my experience.
I can see going, what do they want to know? But anyway, so in our department, we have, which Jamie's a part of, we have 3 master's programs, one in school counseling, clinical mental health counseling, and couples, marriage, and family therapy. And then we have 2 doctoral programs, one in counselor education and supervision, and the other in counseling psychology. And so we have all graduate programs. And I would echo so much of what Jamie said when you're applying. One of the things that I try to remind people is you really want to choose a program rather than just be chosen, right? I think for a lot of people when they're applying, they're just hoping that they get into somewhere. And that, of course, you're hoping to get into somewhere, but do your research, right? And make sure that it's a fit for you. I think sometimes it can feel, and it is, I'm not gonna say it's not a competitive process. It is in most places. And be really thinking about where that fit is for you. Because as faculty, when we're sitting on these admissions committees, we're really looking for fit, right? Because if you come and you don't feel like this is what you want, or you don't feel like a fit, or you're just not fitting in, right? Belonging is a big part of being successful anywhere. And so if you're not feeling like you fit in, or this isn't where you want to head professionally, you're not going to be happy and you're not going to stay, right? And so really thinking about, what is it that I want? What kind of people do I want to work with? Can I see myself living wherever that program is? Do I think I'll be happy there? What other resources are available for me? And looking beyond the program at the university as a whole, right? And how do they support graduate students? And are there opportunities for assistantships? And are there opportunities to, if you're interested in research, to collaborate with and doing research and that kind of thing? So really investigating that, I agree, is so important. And really think about, I'm going to actively choose the programs that I'm interested in, and then apply and put your best foot forward, and then having them choose you, right? And then there's a mutual investment in each other and in that process. I couldn't agree more with letters of rec. I think one of the things that we see when people apply to mental health programs is that sometimes they have a mental health provider or someone that they know personally who's a mental health provider who really isn't in a place to objectively evaluate how successful they'll be in graduate school, right? So I get the thinking behind that 100%. But in terms of us looking at that and going, can we trust the information that this person gave us in terms of their ability to sort of look objectively at this person? So really thinking about people who supervised you or who've been your faculty and who've been in a position to evaluate you so that we have a better sense. And then I guess another piece I'd say about application is, and then I'll stop and turn it over and just blah, blah, blah.
Mhm.
Another piece I'd say is to really tailor, and this is a lot of effort, but getting into graduate school should be a lot of effort, right? Is to really tailor that application to the program that you're applying to. Really get to know it, see what your faculty are doing, what they're researching, what their expertise is in. And again, if that's a fit for you, be really thinking about how do I put my best foot forward on paper? Because at least for our programs, our first review is all the paper pieces, right? Trying to get a good sense of who you are and how you might fit from paper to then invite you for an interview. And I can talk more about our interview process later if that feels relevant. So you don't want to just sort of submit the same application if they're asking for similar pieces just to save time, right? To really put the thought into what do I want them to know? How do I show them that I've really thought about my interest in this program and why I want to go into this field? How do I get that on paper so that I can get to that next step and they can get to know me better as a human off of the paper, right?
Yeah, so I have the luxury of going last, which means I can build on the things that were said before me. The first I'd say is about letters of recommendation. Well, so I read probably 300 applications a year for graduate school at different levels. And so the first thing I'd say when asking for letters of recommendation, I would echo what's been said. Certainly ask early. If you're applying to doctoral programs, for sure you want your letter writers to have PhDs or PsyDs and have some experience in academia and then what you want to do when you're asking, what I highly recommend that you do when you're asking for letter of recommendation is ask your letter writer if they're able to write you a strong letter of recommendation. And that gives the letter writer an opportunity to say, no, maybe I don't know you well enough. Certainly having taken a class with me and getting a good grade is certainly not enough information for me to write you a strong letter of recommendation. But if you're applying to doctoral programs, you certainly want strong letters of recommendation. So I wouldn't be afraid to ask if the individual feels like they can write you a strong letter of recommendation. If they say no, take that as a good thing. That's not a negative. They've given you the chance to get a better letter writer. If they say I'm not able to write you a strong letter, then say thanks and move on to somebody else to write you a strong letter. And I do think that when we talk about fit, I do think it's important for you to think about whether you feel like the program is offering you the training that you want. Oftentimes I'll work with people who get set on this idea that they want a doctoral degree or if they want a PhD. And a PhD is essentially a research degree. You do not need a PhD to practice. You do not need a PhD if you want to help people in the therapy room or in drug treatment or in hospitals. And you shouldn't go get a PhD simply because it seems to be the best degree. It's a lot of work. And it's a lot of work that you may never do again if you don't expect to do research. So thinking about other opportunities, whether that might be a PsyD or a PhD that's less research focused, or even a master's degree that would allow you to get into the workforce sooner, making sure that that fit is there for you as well. I know that we often think about this idea that you want to get to the top and you want the best thing and everyone talks about a PhD. But I think if your goal is to be a counselor and to work in an office or like I said, in some of those medical settings, the PhD may be unnecessary and it's going to saddle you with more debt, it's going to take more time, and it's going to push you to do things that you don't want to do. And so when I think about that, I think about two things. Does the person applying for the program know what they're getting themselves into? So the reason that we want letters from academics is not because we think we're special or elitist. We might be, but that's not why we want those letters. We want those letters. We want people who know what you're applying for, telling us that they think you know what you're applying for and that you can do it. Because for a PhD program, I'm making a 5-year to 6-year investment of my time And I don't want you to not know what you're getting yourself into and then to get into the PhD program and then within a couple of months say, this is not the right place for me. Because of the 300 applications I read per year, I get to make one offer for a PhD program, right? And so I want to make sure that the person knows what they're getting themselves into, is prepared for that level of study, that level of intensity, and wants that degree so that they're going to stick and then they're going to use that space. And so when I think about fit, I think about, is this a good place for you? And are you a good person for this place? It's definitely mutual. It's not one way or the other. And I think that should inform the decisions you're making about when you're applying, where you're applying, and how you're applying for graduate programs. I will echo as well that I pay much more attention to applications that are personalized, that speak directly to me, and that spell my name correctly. I have a little bit of a pet peeve. If you're applying to work with me and you misspell my name, it's probably going to be hurtful for your application. So thinking about these little details, you might say, well, that's egotistical. It might be, but it also tells me something about you. Are you paying close attention to the details? Are you understanding what this process is? If you can't spell my name correctly, then that indicates to me that maybe you're not paying close enough attention to detail. It is an ego thing, and I do have a little bit of pet peeve about it, but the larger issue is I need to look at these pieces of paper or these electronic documents that you're submitting, and I need to know that you know what you're getting yourself into and that you're ready for this. And I have to tell that from 300 people. And so I look for these little things that give me indication that you know what you're applying for and that you know what you're doing. And when I see those things that tell me you don't, then that's going to move your application to the no pile pretty quickly. And so we think about this idea, this first cut, this first pass that often gets talked about. It's based on the numbers usually, or it's based on other indicators to me that the person's not ready. And I'll take that pile of 300 applications and I'll whittle it down to 30 in 15 minutes or 20 minutes because of these indicators. Does that make sense to everybody? And so it is brutal and it needs to be taken seriously. And I think that when you think about these things, if you're going to invest time, energy, and the money that it costs to apply to graduate programs, you want to target your applications to places where you want to be and where they want you to be there. Does that make sense to everybody? I'll stop there for now. Go. Sorry, I also talk very forcefully at times. I apologize for that. I don't have anything to say.
You're like, it's just me.
Yeah, it's just my personality.
Any questions at this point? So
Yeah.
many, go for it.
I'm Lauren. I work with, I'm a professional at Centennial Peaks Hospital and also a prospective student for UNC. Was for CSU, but didn't make the cut this time around. So it's really good to hear a lot of your perspective and information. So I wouldn't consider myself a non-traditional student. I finished my undergraduate degree in 2013 and have a lot of work experience now back in the behavioral health field. I have an undergrad in recreation therapy. But looking at LPC, what are your, I think I struggled a little bit to get the right letters of recommendation for like what would you recommend? You know, from, it's a little different from a person coming from undergraduate because they have administrators and professors to, especially if they're already maybe a UNC student and then looking to continue on. What would you say are the best people to get letters of recommendations from? Obviously, from my perspective, anyone that understands and knows me as a person, under my work experience, and a couple of clinical directors that I have worked under for some organizations. But any other thoughts around that?
Yeah. So you're asking about like at the master's level application, and
Yeah.
for those of you that don't know the acronym for LPC, Licensed Professional Counselor, it looks like most people know what you mean by that. So, and it's the other piece of that for someone who's maybe been out of school for a while.
Yeah.
So I would say someone who has supervised you and knows your work. They may not be able to speak to your academics, but they, because it's to go back X number of years to a professor that might have had you at undergrad. Unless you really work closely with them, continue to have some contact with them, whatever the case may be, they could speak to one aspect. You could do that. It wouldn't hurt because then they can speak more to that academic side of you if they remember you and can actually so do that some justice, right? So I would really look at supervisors, people who could evaluate you, so some had some evaluative authority in the work that you did is where I would focus things.
And,
Over.
yeah, go ahead, I'm
I
sorry.
was gonna say, I think that's another primary difference. If you're applying to programs that are primarily training clinicians, then supervisors can write letters. If you're applying to PhD programs, then letters and supervisors may actually hurt the application as opposed to academics. And so if you're, I would consider you a non-traditional student because of the amount of time you've been out of school.
Oh, okay.
And so going to get an LPC or another master's degree where you'll get to be in academia and do academic work again at the graduate level will make an application stronger if your long-term goal is for a PhD.
Absolutely.
Like, so for instance, in the master's program that I run, you graduate with a master's degree in counseling, but you can also take extra courses to get to LPC by equivalency. You work
I was
closely.
gonna ask that.
Yeah. So you work closely with the professors. And so if you go that route and you get to know us, and then you also want to apply to PhD, now you've got the relationships with academics to get the letters you would need to get into a PhD program.
Right. So CSU offers a dual LAC and LPC master's track.
Yeah, and we're actually about to launch a dual LAC and MSW, at least LCSW track as well. It'll launch for in-person coming class this fall. We haven't started recruiting for it yet.
Okay. Does UNC also have an LAC, LPC?
We don't, we've been talking about it, but
Okay.
we don't yet.
I think
Yeah.
that's the niche I'm really interested in, is LPC and LAC, but I've also considered the LPC and the CAC route just up into just before the LAC.
As far as I know right now, the program at CSU is the only joint LPC track. I think there are others coming online. And then when we launch the LCSW LAC track, it'll be the first of its kind as well. So,
Awesome.
and that's a 3-year program. So it adds a year so you can meet both the credentialing requirements for LCSW and for LAC.
Thank you.
If you feel that you're working in the field, like actually working with clients as like a counselor, but wanting to kind of elevate maybe into more of like a director position, leadership position, but also still a team. That was kind of the goal. Would you recommend 2 master's degrees or a PhD? Like, what do you think looks better and makes more sense if you're supposed to continue working with clients and seeing and doing therapy, but wanting to elevate it from just one graduate degree up to the doctorate level or having this?
Go for it, go for it.
I think that you only need a PhD or a PsyD if you want to do research, if you want to do assessment. And beyond that, you're investing money in a degree that may not be as useful for you as you want it to be. I don't think that's a cut and dry thing, but if you're not looking to do assessment, then, or again, to do research, then I don't think a doctorate is the right route. I think that work experience and master's degree or master's degrees, I don't know how to pluralize that, is probably going to be more beneficial, but that's my thoughts.
Yeah, I think it depends on the doctoral degree. Because counselor education and supervision, it's a different kind of doctoral program. It really is training people either that want to go into the academy as faculty and train counselors, mostly at the master's level, or want to go into clinical positions with a doctoral degree with that clinical supervision focus. And so but again, I think it's still to the point that you're making, it's a huge investment in time, right? In terms of our field and entering in at the master's level, so much of working towards a leadership position is being in the role, being in the agency, learning the agency, sort of advancing to higher levels of clinical supervision, administrative aspects of that whatever the organization is, that kind of thing. So I don't think it's as degree specific as it is more experience within whatever setting you're in, and then building those leadership characteristics and competencies and that kind of thing. Yeah.
So I have 3 semesters left for my undergraduate, and I was wondering when would be the right time or the best time to apply for graduate school for a year.
So this is your this spring and then fall and spring of next year.
And I have 3 more after this.
So you do fall, spring, fall, or fall, spring, summer. Sorry.
I can't do summer.
Okay.
So
So you'll still be an undergrad in fall of 2020.
that'll be my, yeah.
Then you would apply in fall of 2024
Okay.
for PhD programs, and for some PhD programs also, or PsyD programs, the application cycle can go into January. And then most master's programs are also going to have admission cycles that are a little bit behind, at least in my experience, a little bit behind the PhD program, so they'll be in the spring after you graduate. So for instance, our master's program, the application deadline is April 1st, which is quite late, actually. I think yours is probably earlier, but I'm just guessing.
Yeah.
Yeah.
Yeah, so depending, doctoral program earlier, usually December, ours is December 1st.
Ours is December 1st as well.
So, and that's pretty hard deadline too, because that's part of that professionalism and making sure, we're looking at, are they able to get their application in on time, right? Our master's program is around the same time, December 15th, for our on-campus program, our Greeley program. We have master's programs in Lowry, in Denver, and in Loveland as well, that are designed for the working professional, someone who can continue to work, and they do class and weekend intensive format. So those applications are in our Lowry campus. That's a rolling application process. So there's no hard deadlines necessarily. Our Loveland one, same as December 1st is priority, but then we continue to accept applications through until, I think that, trying to remember what the new deadline is. I want to say May 15th or something like that. But that's a fall start only. In Greeley, we have a summer or a fall start.
Great, thank you.
Yeah, I kind of have an idea of what it is, but
Yeah, you bet. And jump in if you want to talk it off.
I feel like you're more informed than I. Okay, Kevin, thank you.
It's important as well. So KPREP is the accredits master's level and doctorate, well, counselor education supervision, but specific to counseling. So not psychology, APA accredits psychology degree programs. So KPREP, I can tell you what the whole acronym stands for if you want, but it's probably less relevant to you than what it means. So essentially, any kind of accreditation of programs really says that this program is meeting the standards necessary, in this case, for most licensure. Really, it's tied to licensure in a big piece, but to separate that, accreditation is really saying some external organization has come in and looked and seen if it is seeing if the program meets those standards that they've set as necessary for appropriate counselor training. So a group of professionals kind of come together and decide what those are. It's a huge process. It's an expensive one for an institution. What it means in terms of licensure at the master's level is in most states, if you're KPREP accredited, you don't have to go through the equivalency process in a state to get licensure. So that KPREP accreditation says that your degree meets the standards for licensures. Like I said, in most states, not all states. So that just to make sure that that's clear. That's true in Colorado, that you have to have that KPREP accreditation and not have to go through equivalency. And equivalency is essentially just a bigger process with the state. Here it's Department of Regulatory Agencies, reviewing your degree program, your syllabi, that kind of thing, to make sure that it is essentially KPREP equivalent or equivalent for licensure. So it's just a bigger process to do that.
And actually, the state of Colorado has now farmed out their equivalency analysis to a company in Atlanta, Georgia. And it basically is another cost that you incur as well. So if you don't go through a KPREP accredited program, you have to pay this agency in Georgia to evaluate your syllabi and to make sure they line up. And then they send a letter to you that you submit, in this case in Colorado, you'd submit to DORA that shows if you didn't go to KPREP accredited program, you've met the requirements by equivalency.
Another piece that KPREP accreditation gets at the national level is there's a national counselor credential, nationally certified counselor. I was like, what does that stand for? Sorry about that. But you can take that exam to have that NCC credential before you graduate so that you have it at graduation if you're part of a KPREP program. So it gives you sort of that additional, little bit competitive piece there.
Did I hear you guys for UNC have an internal practicum? Okay, that's all students, their second year?
Yeah, for most, it's in their second year. Yeah.
Oh, okay.
Yeah, so we have a clinic here, psychological services clinic, that's right in our department. So we see students on campus, but also mainly community members is who we see. And
Okay.
so we have an internal area that we call the cave because it's dark so that the one-way mirrors, they're not staring back at you. And so, yeah, you're very closely supervised, and Jamie could talk about that experience more, but somebody's actually watching you, which brings up a lot of anxiety for people, but we really try to reduce that anxiety. But what it does is really prepare you for then your future clinical experiences. And because some clinical experience and some clinical training is done without a lot of eyes on. And that can be managed without a clinic. You can certainly do some eyes on work and recordings and that kind of thing. But having that level of supervision just, I think, creates confidence, that self-reflectivity piece, self-supervision piece, and people just come out into their field experience a little bit more confident and, quite honestly, I think more confident.
Yeah, CSU has the same, it's like, we call it Psychological Services Center, but it's on campus. And for the Ph.D. counseling program, our students go there in the third year. In the second year, our students all go to the Health Network, which is the University Counseling Center on campus. So we have 2 internal prac before our students go to external prac. At the doctoral level, at the master's level, we place some students in the training clinic, but the vast majority will do an internship in their second year out in the community for addiction counseling.
For LAC and LPC, I know recently there was something just passed, I think, in the state where if you're in the LCSW or Master's for Social Work program, that you're allowed to be paid during your practicum or internship. That's true?
I don't think it was passed at the state level. I don't think the state governs whether you can or cannot be paid. So it's within the profession and then within the
Okay.
university where they make those determinations.
So maybe CSU just made the decision.
CSU social work program just made the decision to allow students who want internship to get paid. The students in the addiction counseling program have always been allowed to get paid on their internship.
Okay.
The students in the PhD counseling program are always allowed to get paid
Okay.
on internship and on external prac. They just have to negotiate because we pay our students are stipended. I don't know if the students in the PhD program here are stipended. So stipended students have a contract with the university about how much they can work and about where they're going to get their money from. So it's a little more complicated,
Sure.
but it's becoming more common now. And
Yeah.
I think with workforce shortages that we're seeing around the state, that probably will
Yes.
continue to become more common, that these training placements will start to offer financial incentive to recruit students to come work there.
And
Yeah.
that's same with us. We don't exclude our students from being able to be paid.
Okay, that's really good to know. As a working professional, it's extremely anxiety ridden to imagine my life without working full time. Even if that just means shifting my job role to doing obviously something clinical versus doing marketing business development, what I do now. So that's really good for me to hear. And my last question is, at the Loveland campus, what do those intensives look like? Are they just short weekends?
Yeah, that's a great question. So in both the Loveland and Lowry campus, so a 3-credit class, it's 2 weekends. So nobody takes any classes all at the same time, right? So not in a traditional program where you're taking multiple classes over the course of the semester. You take one class at a time, but at the same level. So if it full-time is 9 credits, you take 9 credits over the course of the semester. But again, you're just in one at a time. And it's 3 credits is over 2 weekends. There's obviously lots of work that happens in between those 2 weekends and at the broader ends of those weekends, but you're in class for 2 weekends. And it's a Friday evening from 4 to 10, Saturday from 8 to 5, and Sunday 8 to 4. And there's a week in between, and then you're back in the class. And again, there's lots of work that happens in between all of that, but those are the actual class times. So for taking if you took 3 classes, 9 credits, most of our students take between 9 and 12. 9 credits would be 6 weekends over the course of a semester. 12 obviously would be 8. Yeah.
Other questions?
Can't hear you.
Yeah,
I'm
I'm having
sorry.
trouble hearing you as well.
It's hard with a mask, I know.
What kind of resources support systems undergraduate students that
In our program, we have a grad coordinator who meets with all the students or the prospective incoming students over the summer and gets them prepared for what the semester is going to look like. And then we develop mentorship plans with each one of the students to, so I serve as primary advisor for all the students in the master's program. Plus we have a co-advisor, and the students meet with them at least once in the beginning of the fall semester to identify needs and address barriers and find ways to make sure the students are going to be successful. And that's in the master's addiction counseling program. In the PhD program, it's a much more intensive sort of one-on-one relationship with the advisor, where I start meeting with the students right after they accept their offer and get them prepared to be ready for the start of the semester in August. So the Master Addiction Counseling program tends to have a lot more non-traditional students, so we provide a lot more institutional support and try to address barriers for non-traditional students at every step of the way, whereas the PhD program, it's more about the getting ready to give up the next 5 years of your life, essentially.
Jamie's about to start a doctoral program, so every time you
Probably
say something, I'm
scaring her
like,
very
it's okay,
badly. I
it's okay. Yeah, very similarly. I mean, it's, I think we have an orientation, so all students get oriented, so sort of, pay attention to the handbook and do all that kind of thing. You're assigned an advisor. And I think that's one distinction between any graduate program. Again, I agree, in the doctoral program, that one-on-one mentorship with your assigned advisor and then your research chair and that kind of thing. That's kind of that's a very intensive working relationship. At the master's level, I see master's students not engage in that advising relationship as much as they probably should. And one thing I'd say, I think sometimes it feels like, well, I should go to my advisor. You should. And if you have a relationship with other faculty or connect with another faculty, make that switch, because if you have that comfort level to go, you're going to get the support that you need. And then institutionally, things like the GSA, the Graduate Student Organization, there's a lot of assistantships so far in terms of financial support across campus that our students are really competitive for. We in our internal in our program, we only have assistantships for our doctoral program. We don't have a lot of financial support for our master's programs, but all advisors really help students try to find those. And you can always, find what's available on the graduate school website in terms of funding and that kind of thing. Obviously, counseling center, that kind of thing. One thing that's unique for counseling programs, at least in our university, if you want to work in our counseling center, now that wouldn't apply. We have students who work at CSU and their health network and whatnot. But if you want to work in our counseling center here as an intern, they won't accept clients. They won't accept people who are clients in the counseling center just because of the dual relationship, and just it would be too messy, right, from an evaluative perspective. And so that's just something to keep in mind, not anything to necessarily worry about, but yeah.
Another thing to think about, and along the lines of supports that can happen after you graduate, is currently the state of Colorado offers loan repayment for individuals who are willing to work in shortage areas, which are largely rural communities, many of which exist in the eastern part of the state. Some areas in Greeley qualify as shortage areas, where if you're working in Greeley, you can get loan repayment. So most of the master's programs, you're going to be funding out of pocket. It's much more difficult to find the assistantships for the vast majority of students who are in master's programs. And so a lot of that, the debt that comes from getting a master's degree is incurred by the student. But there are these new after graduation loan repayment programs. I think there's going to be more that are developing. So keep an eye on those. If you go to the Office of Behavioral Health webpage, there's a lot of links for those. They also offer some scholarships for some of those trainings as well. They're not going to cover all the costs, but they're going to significantly offset the financial burden of graduate education if you're willing to work in these underserved shortage areas.
One thing I just got to thinking about is that we have a certificate in play therapy in our programs as well. So if anybody's interested in working with very young children, we have training in that, and also have a practicum in our psychological services clinic for direct training in that as well. So.
Can you take master's level classes during your undergrad?
So technically, seniors can take some 500 level courses. In our program, ours are almost all, except for our stats course, are almost all majors only. So it's pretty limited. Yeah.
If you're going into graduate school for counseling at any level, we tend to work in a cohort model. We like to keep the classes towards people who are going to be working with each other over the next couple of years, because a lot of the work that we do creates a lot of vulnerability for the individual. And so we try to keep things closed up. We do the same thing for that. It would be very difficult to take graduate level courses in the counseling program curriculum as an undergraduate. I think you could take methods courses, stats, and maybe research methodology and things like that. But the actual applied counseling classes are closed, and I think it's probably the same here as well. I mean, they're when we say within the major, like even undergraduate students who are not studying counseling wouldn't be permitted to take the counseling class at CSU because it just creates too much of a different dynamic and it can be too stressful. So we keep those classes pretty insulated.
Thank you.
Yeah, there's a lot of work on who you are, right, as a counselor. That's a big piece. And so I think just to name that and to recognize that this is that particularly at the master's level, it's true at the doctoral level too, depending on the program, there's a lot of that person of the counselor stuff, right? So if you're looking for a purely academic program, you all can imagine this. Counseling probably isn't for you, right? Because there's a lot of self-reflection and a lot of learning and growing that takes place and pushing some of your sort of preconceived notions or the ways that you've typically seen people, pushing the boundaries of that a little bit to see beyond some of your biases and whatnot. So just to name that as a piece of this.
5 minutes left. Ask any last questions.
I heard that you can do a master's with a supplemental.
Yep, yeah, you can. Yeah, so you can get a dual degree. And I think the thing to know about that is you are required to internships. So, and both would be 600-hour internships, but yeah, you can get both degrees. Yep.
Is that the same for LAC and LPC at the master's level at CSU? 2 internships?
1 internship, 2 semesters, but 1 internship. So it could be the same placement for the year. You can double count on that program.
Okay. Also at UNC, how do you all accommodate, if you're doing an internal practicum, how do you accommodate graduate students that are interested in under the clinical mental health umbrella, specific populations, so like psych, or like higher acute psych, eating disorders, adolescents, things like that?
So it's the Psychological Services Clinic, the in-house practicum is only our first practicum.
Oh.
So there's a second practicum that's
Okay.
all field-based, and then the 600-hour internships, all field-based.
Oh,
So people
okay, I
can go
understand.
out, yeah, sorry, I'm glad you asked that.
It's okay.
So you can go out and specialize in areas or get experience in areas that you're interested in.
It's looking at the curriculum, it's a little hard to decipher what fits where for practicum hours, so thanks for explaining.
Yeah, sure.
On the other hand, yeah. Oh,
Before applying to the actual program itself, we don't have a minimum requirement for experience.
that's 0
Yeah.
for any of the programs we run as well.
Yeah.
There are hours requirements for graduation, but not to get into the program.
Same. Yep.
I have a quick one just about following up on the personal statements and besides personalizing, like what else beyond that tips for personal statement or statement of goals?
It's okay.
Go for it.
So it depends on what the level of program you're applying to. You know, for the master's programs, I think you can focus on a lot on work experience and about the population you want to work with. For the master's addiction counseling program, the statement of purpose is our primary piece of evaluative information for admission. We really want to recruit people who we know are invested in helping people who are struggling with substance use disorder. For the PhD, it's really about demonstrating that you understand what you're getting yourself into and that you're ready for that. So they're a little more, they're not as personal. Like we don't want to read letters for the PhD program, statements of purpose that include your family's mental health history or your own mental health struggles, because that's not relevant to what we're doing. Whereas in addiction counseling, having some lived experience can often be useful. And so they're very, very different letters. And so if we're talking about master's letters, I really think that you emphasizing work experience, emphasizing any training you have that's going to make you a better candidate for the field, even emphasizing lived experience in some programs can be really useful. And for the PhD programs, really focusing in on research, on clinical work, on future career orientation, and then why you and I are a good fit, why you want to be working with me in the lab that I run.
Yeah, so I would agree, different levels, right, and different programs, right? So counselor and supervision, a little bit different than counseling psych at the PhD level. If you're talking about master's program, work experience, I think also that piece of just understanding of the profession, you know, I think we don't expect you to have a comprehensive understanding of it, but to know what you're getting into, right? Here's why I'm interested in counseling. Here are some of my future goals, and if those are consistent with the program you're applying to, right? So I think really thinking about that. And then just, this sounds so silly, but edit it. Have someone else read it. See if you think, if you've forgotten anything, because I don't think we're often used to talking about ourselves in that kind of way, in that kind of a format. So get some feedback. Don't shy away from getting that feedback and edit it. That's huge, because I tell you, if I'm reading and I can't make sense of what you're saying, or there's a bunch of mistakes at the beginning, that sets a tone. And we get so, like, same thing, so many applications that you really want to just try to stand out, right? And that is a huge piece.
And I'll just add, when you're considering applying, you know, there are grad program coordinators and people who work, you should contact us and ask us whatever questions you have. You're not going to bother us, you know, and I have this sort of standing statement that I say to people, which is don't ever say no for me. Like, if you want to ask me to read your statement or something, just email me and ask. And if I have the time, I'll say yes. If I don't want to do it, I'll say no. But if you say no for me, like he's too busy, he's not going to do that, then I'm definitely not going to do it, right? So, but the idea is have lots of communication, especially as you're trying to make this decision. We all know this is a big decision for you about where you're going to spend your time and how you're going to get your graduate training. So contact us and ask us all these questions, and contact other coordinators. If you can find students who are in the program, ask what their application experience was like, what the process is like, if they like the program and they want to be in. I feel like we dominated, didn't give you much
No,
chance
that's
to talk. I
okay.
apologize.
These are good questions.
But don't be afraid to reach out to the grad program coordinators and the people on admissions for more information. I would do that.
And I think you made such a good point. Talk to current students. They're the best resource. We have a group of leadership fellows in our program. They're a great resource to talk and ask about the program. And if faculty in any program you're going to won't connect you to a student, be worried.
Agreed, 100%, 100% agreed.
So, yeah.
Awesome. Well, thank you all so much for your time. Thank you everyone for your questions. Unfortunately, we are at time for this session, so thank you all so much. We will be taking about a 15-minute break, and then our third and final breakout session will begin at 11:30. We'll have one in this room and one over in Aspen as well. But thank you all again so much for sharing your expertise.
Thank you. Good luck, everyone.
Yeah, good luck. Yeah, that was late.